This lecture is Bioethics and Communication. My name is Masami Maruyama, Department of Health Sciences, Graduate School of Medical Sciences, Kyushu University. I own 8 entry to Professor Machiko Fukuhara, Dr. Naoki Asazuma that for succeeded and an expression of thanks. At first, introduce myself. When I was 26 years old, I was a clinical instructor for the first time. My first paper, Application of the Drawing Picture Method on Clinical Teaching of Nursing. This paper accepted Asia Pacific Convention in Singapore. My opinion, in nursing it is important to master accurate skills and excellent techniques. However, it is more important to master the psychological techniques that can be learned by talking and listening to practice, and by studying their expression as well as their behavior. I wanted to study more harder and stop my job. 30 years ago, I met Professor Machiko Fukuhara in her lecture. When I was one of graduated student. 1997, I worked Kyushu University. Now, sometimes and I'm going to Georgetown University Kennedy Institute. My specialty is bioethics. The bioethics is cooperative and supra-interdisciplinary study that widely protect human dignity and human rights and surpasses the framework not only of the medical fields but also regulation for new wisdom that surround human life. Bioethics and Encyclopedia of Bioethics, first in the 1978, now in the 4th edition. Bioethics as the systematic study of the moral dimensions, including moral vision, decision, conduct, and policies of the life sciences and healthcare, employing a variety of ethical methodology in an interdisciplinary setting. Principle of biomedical ethics. First principle. 4. 1. Respect for autonomy. 2. Justice. 3. Non-maleficence. 4. Beneficence. Second principle and A. Promise keeping. B. Truth telling. C. Confidentiality. D. Loyalty of confidence. My research is bioethics, a comparative study about the view of life and death of term of truth-telling. This is Korea, China, Japan, East Asia country. It's very near, and my idea is very near the same, but in the little difference. For example, Korean data. analysis of willingness survey in Korea, neither self or family, 7%. Systematic study in medical field, 4 principles. First principle and case-by-case medical field, and sometimes specification and justice, or in the balancing principles and 4 principle. It's very difficult. It aimed to respect not special authority, but the client's seeing of value and to build up equal relationship between medical professionals and the patient. Futility as a relational concept, choosing the right technology for this patient. How may I help you? Clinical goal, patient's goal, in parallel. Professor Rihito Kimura is a very famous bioethicist. He is working in Waseda University. And he said that the 5 elements are very important. 1. Dignity of life. 2. Do not cause harm. 3. Idea of respecting share and diversity. 4. Where a mistake. 5. Dialogue and symbiosis are essential for the basic idea of bioethics. Professor Kimura states that the decision-making process based on various sense of value is important for the process for bioethics in medical service, and its factors include in flexibility that correspond to the individual problem situation. 2. Dynamism of communication. 3. Legal process of the relation between healthcare worker and patient. In the care, practice of life that respect patient consensus building is achieved through communication for the relationship between medical professionals and patient for information, for informed consent. In that case, medical practice is continued while dialogue is continued through when a conflict occurred. For value judgment between them, it becomes necessary to respect the value judgment by patient basically and analyze and clarify factors for why they cannot reach mutual agreement except exception, since it is necessary for both to share the recognition, what we understand for each other, what we do not. It is essential to learn how to live faithfully from school days for dialogue of medical professionals. When mentioning about human rights and human dignity, bioethicists generally express reflection for the inhuman race policy of Nazi after World War II and prescribe inviolability of human dignity. Born fundamental law of West Germany, which declared this as a country's responsibility, is preamble and Article 1st of the Universal Declaration of Human Rights to identify human dignity as one of the citizens' common belief. Effective scenes for information agreement by the third party such as second opinion, outpatient department are seen in recent clinical scenes. A. Patient paternalism. She is informed dissent. B. Physician second opinion. The new idea. Informed consent is very important 7 elements. 1. Competence. 2. Voluntariness. 3. Disclosure. 4. Recommendation. 5. Understanding. 6. Decision. 7. Authorization. Further, on the other hand, some couples see prenatal diagnosis whose original purpose is prenatal treatment as a means for gender selection by the pregnant woman. Inheritance counselor is appreciation for such pregnant woman, and therefore dialogue would be essential. This is a communication textbook, and my student learning first in micro-counseling theory and practice. This is Professor Machiko Fukuhara and IB, and second and fundamental of nursing, and this is present for me, Carol Taylor. Communication. The work communication is from Latin, meaning tell, share. However, in today's medical practice for a case that conflict occur for of the value judgment between the patient or factor for not reaching agreement, it would be necessary to perform a case study or clarify reason for them as a sender and receiver of information and the signal and the message that are beyond the meaning of etymology. The various components in the process of communication, sender and receiver, and very interesting channels: visual, auditory, kinesthetic. Visual in mode of transmission, sight, observation, perception. Auditory, hearing and listening. Kinesthetic, procedure touch, caring touch, bed bath and care and nothing is caring touch. Since continuous of dialogue by medical professional relieves the anxiety of sick person and weak person or causes anger in some cases, having a power to change the directionality of the scene, it is necessary to learn consciously through not only theory but also practice. This is a very famous textbook, Narrative-Based Medicine, Thrasher Greenhard, Brain Habits. This cover is Files, Doctor. This art is in Tate Gallery in London. Our textbook cover the same, the doctor. And this is very important things, narrative-based medicine, narrative-based nursing, narrative as dialogue and disclosure in clinical practice is very important. The same humanity. I think so that. That's right. And the Medical Museum of Kyushu University, and the purpose of this museum is to collect and preserve valuable historical documents related to the variety of medical research carried out at Kyushu University, to pass them on to further generations. One of our primary objectives is to conduct research based on historical sources and by holding exhibition to present the result of these activities, not only to contribute to medical education and research, but also to communicate the history of medical sciences, healthcare, and treatment to our broader public. Welcome to Japan. Welcome to Kyushu University. Thank you for your attention.